up, everybody, no more sleeping in bed.
The World Health Organization has a Mythbuster site where they discuss myths and then busting those myths. And one question they answer is, are antibiotics effective in preventing and treating the new virus? And so their assertion is, no, antibiotics do not work against viruses, only bacteria. And we are going to look to see if this is accurate. As a matter of fact, we're going to look at a number of research articles to see if this is a valid and reliable assertion or whether or not it is in fact a myth. And this is Dr. Tracey McCarthy, psychologist, attorney, and educator, and we are going to be looking at Mythbusters, and this time we are putting science on trial. And we're going to be looking at Mythbuster number 1.
Only thing we have to do is put it in.
And first we're going to look at an article by Menzel et al. And this is out of 2016, so this is quite a while ago. And it indicates that the antibiotic azithromycin induces antiviral effects related to COPD patients. And in this article, you can see that the researchers have indicated that azithromycin reduced viral load. And so this is very important to make note of. Now we're going to look at Mythbuster number 2. And here we have yet another article. This one is a bit older. This is from 2010. And this one indicates that azithromycin induces antiviral responses. Now, this article specifically looks at the rhinovirus and the role of azithromycin with the rhinovirus, and also looking at some issues related to asthma. Now, one of the things that this article points out is that azithromycin has anti-rhinoviral activity in the bronchial cells. And continuing on with Mythbuster number 3. And here we have a more recent article. This one is out of Tokyo, and this is from 2019. And this one indicates that azithromycin inhibits influenza, and specifically H1N1. Now, this large group of researchers indicated that they found that virus replication was remarkably inhibited by treating the viruses with the azithromycin before the infection. They also did some studies looking at the impact of intranasal azithromycin treatment, and they found out that this also successfully reduced the viral load in the lungs. Now we're moving right along to Mythbuster number 4. And you can see here, more recently, the interest has continued related to the role of azithromycin or antibiotics in the treatment of viral infections, and very specifically this situation that is currently going on. And so you see some researchers in 2020, June, very recently, looking at azithromycin and considering it as not just an antimicrobial. And here these researchers indicate that there are a number of arguments that support the potential effectiveness of using azithromycin in this current situation. So they are looking at the fact that it has antiviral activity, and it is also an immune modulator. And so they are suggesting that clinically there should be investigations with azithromycin as a monotherapy for individuals who are dealing with the current situation. As we wrap this up, we see that there are some holes in the World Health Organization mythbuster rhetoric. And so there is an assertion that antibiotics do not prevent or treat viruses, and they only work on bacterial dynamics. But you can see, based upon this long-standing research program, that azithromycin specifically works on a number of viruses. And not only does it have an antiviral impact, it's actually immunomodulating. And so that's very important to keep in mind. And it works on a number of viruses. So there's an impact on a number of viruses. This also brings into question this assertion that antibiotics don't work on viruses or viruses don't respond to antibiotics. Perhaps in some instances, what is going on is that you're not actually dealing with a virus, and that's why there is this responsiveness. And so researchers and clinicians need to almost automatically look to see if what they are dealing with is another microbe, such as mycoplasma. Some people are uncomfortable discussing some of these issues and questioning some of the rhetoric that's out there that changes from day to day along with these varying recommendations. But it's very important in terms of science, in terms of health, that people question and people consider all sorts of frameworks and alternatives. You always have to question. You need to do your own research. You need to be your own researcher. You need to be your own scientist. You need to be your own health partner with your other health partner so that you get the best answers possible and that you get the best care possible. There are multiple ways to address a number of issues, and so it's important to understand all of the options that people have at their disposal. Remember, knowledge is power. Take care. See you soon.
Don't push out. Stop pushing that. Don't push. Stop using the door. Stop preaching what you